Good morning, everyone. My name is Representative Cedric Frazier, District 43A, the cities of New Hope and Crystal. I'm also a co-chair of the POCI Caucus, and I stand here today with my colleagues and advocates from the community. Today we stand proud of the progress we've made and united in our commitment to protect those hard-won gains and keep building a Minnesota that works for everyone. From cannabis legalization to ensuring BIPOC entrepreneurs have a real chance in this emerging marketplace, from the classroom to the courtroom, from our healthcare system to our economy, we prioritize equity, inclusion, and justice. We've expanded ethnic studies in public schools, increased support for English language learners, and provided more counselors and alternatives to exclusionary discipline. And we've taken critical steps to reduce suspensions and eliminate seclusion for our youngest learners, because K-3 students deserve support, not punishment, especially in moments of stress or struggle. These changes help ensure every child is treated with dignity and given the tools they need to thrive. We've invested in safe communities through reforms like limiting no-knock warrants, funding for violent crime interventions, and community-based violence prevention. We've taken bold steps in economic development, dedicating hundreds of millions to support BIPOC businesses, affordable housing, and working families. And we've led with equity and how real opportunities in the new marketplace. But we didn't do this alone. Today, we're joined by community members and advocates whose voices, lived experiences, and tireless efforts made this work possible. You'll hear from them shortly, and their stories remind us why protecting these achievements is not optional, it's essential. And now I will step aside, and I will invite up Amanda Otero, Co-Executive Director of Take Action Minnesota.
In 2023, Minnesota did the right thing by passing Earn Sick and Safe Time for all workers across Minnesota. This common sense step toward ensuring dignity for all workers, no matter where we live or what we do, affirmed a simple truth. None of us should be fired or risk being able to put food on the table because we're sick or we need to care for a loved one or because we've suffered domestic abuse or assault. This week, 6 members of the Senate DFL joined Senate Republicans to put that promise in danger. This move would take away Earn Sick and Safe Time from over 100,000 workers who have been earning and using it for 16 months now, for no other reason than the size of their employer. We're here today to ensure that these carve-outs don't make it a step farther. Let it be clear, sick is sick. It doesn't matter if you work in a small business in the metro or as a farm worker in greater Minnesota. It doesn't matter if you have 4 coworkers or 40. The need for paid time off to see a doctor, get out of an abusive relationship, or cared for a loved one doesn't change because of the size of your workplace. Paid sick days are a universal need and a basic dignity that all Minnesotans deserve. Take Action Minnesota has talked to thousands of Minnesotans this year, and their message is clear. We need our policymakers to protect gains like ESST. Minnesotans across the state have sent over 1,000 emails and in just 2 weeks gathered over 300 written cards for their legislators calling on them to defend our rights. This is about dignity, not loopholes. Cutting corners on ESST doesn't just hurt workers, it weakens the foundation of what makes Minnesota great. No worker should be left behind. No exception should be made to basic dignity. Now it's up to the Minnesota House and Governor Walz to do what the Senate would not: reject these carve-outs and protect the rights of all working Minnesotans. Thank you.
My name is Representative Esther Agbaje. I represent House District 59B, which covers North Minneapolis and parts of downtown Minneapolis. So we're here today because we want to protect our wins. And one of the wins that we want to protect, in addition to EST and some of the others you heard about earlier, is undocumented health care for Minnesotans, or health care for undocumented Minnesotans. I was the author of that standalone provision in that bill. And when we passed that provision, along with all the others, we did so with the intent that this would be law and that all people of Minnesota would benefit from ensuring and knowing that more people had access to health care. Knowing that you can get help when you're sick and not have to worry that you may be stolen from your family is beneficial to building more stable workplaces, schools, and communities. Hearing that Republicans want to repeal this provision is troubling because it is the same playbook of seeking to divide Minnesotans. It is especially sad that they have injected into the conversation that some people must simply be left to die because their costs are too expensive. We know that undocumented residents pay taxes, and since enrollment started, we know that many more people have signed up than we originally expected, but they have actually had less claims being made. Yet what is more expensive to me is the cost that we pay for emergency and uncompensated care. It shows that our entire system is underfunded, and it makes it unsustainable in the long term. Yet instead of focusing on how to make healthcare better and more successful, there are those who would rather scapegoat one group as the source of all of our problems and force the rest of us to abandon them. And as we move into more uncertainty at the federal level with the potential Medicaid cuts, we know that strengthening the safety net for all Minnesotans is more important than ever. It is our duty to create the circumstances where Minnesotans can live their best lives and thrive. And as a POCI Caucus last biennium, we did focus on ensuring that everyone was represented in the laws and programs that we passed, and we left no one behind. And in the remaining days of the session, we will continue to do what we can to ensure that that remains the case. And so now here to share some stories about how this particular program has worked is Emilia Gonzalez Avalos, the Executive Director from Unidos.
Thank you, Representative. My name is Emilia Gonzalez-Avalos. I'm the Executive Director with Unidos Minnesota. We are a power organization that organizes for social, racial, and economic justice across the state of Minnesota. And access to health care is good for all Minnesotans. The COVID-19 pandemic made it clear that the relationship between community health and economic health is tied together. Slashing healthcare expansion for the frontline mixed status families that kept Minnesota running at a disproportionately greater risk to the health and safety undermines our shared value to protect those who kept us safe while we all sheltered in place. I know that well because my father was one of those workers. He has been living in Minnesota since the early 90s. He's been waiting for an immigration remedy since 2001. Since 2001, he's been waiting for his immigration remedy to arrive. I am a U.S. citizen, and my father has been an essential worker throughout all this time. He worked in construction, he prepared food, and at the end of his working journey, he was preparing and packaging food in a suburban factory through a temporary agency. That's where he got the virus. He got infected with COVID-19, which sent him to a very long stay at a local hospital. Throughout all this time, my father paid his taxes. He didn't get into any trouble. He did the best that he could, and he contributed to the state. He was often beloved for being one of the most harder workers, and he earned several awards for Worker of the Year and Worker of the Week and Worker of the Month. Everybody knew and understood the sacrifices that people and parents like my dad made it so that people like me could have a better chance. And so when I hear that some politicians call people like my father criminals or that they're getting free health care, I cannot wonder, why do they make up these lies? My father contributed throughout his work. He helped everybody that he could. He paid his taxes, and he contributed to the betterment of the state for over 30 years now. And so now that he's older, now that he's tired, that he got disabled through a very long COVID circumstance, there's very little opportunity for him to get the care that he needs. He's entirely disabled, he lost a kidney, and he consistently needs care. I cannot provide that care for him. I'm not a medical worker. He needs to go to hospitals. He needs the care that he deserves. And so I want to remind Minnesotans that we had a pandemic, that we called these workers heroes, that we were all very grateful that somebody was still picking the food and processing the food and cleaning the places so that people could be sheltered at home. We got bipartisan support of some of those provisions that helped those essential workers in this Minnesota legislative session. And they forgot too quick who those workers were. They forgot too quick who people like my father are. And I just want to remind them that this can be just one example of what global health means when we don't do policy that is sound, that is comprehensive, that is good public policy, like Minnesota care coverage for undocumented workers. And next, I will introduce our City Council member from Ward 9, Jason Chavez.
Good morning. My name is Jason Chavez, and I proudly represent Ward 9 on the Minneapolis City Council, one of the large, racially diverse locations in the entire state. And as we head into the last few days of the legislative session, it's clear that the message is about undocumented immigrants and their health care access, even though it's only a small part of the state's budget. What's not small, though, is the impact that stripping away healthcare from undocumented immigrants and what it would mean to our communities and to your neighbors. Healthcare disparities would only worsen in the state of Minnesota, and those who we love would die. Last year, I got a call from my mother. It was while I was at work, and we found out that my father had cancer. And he had to get surgery just so he can survive. And that surgery went well. And then he had to have another surgery because the cancer came back. And you know, when you get that call that your family and loved one has cancer, you don't know what that means. You would think about the price that it's gonna cost your family, which should be the last thing you have to worry about, because you should be worried whether your loved one's gonna survive. His situation has improved. And thankfully, this year, he was able to apply to Minnesota Care. And that's because we had legislators and community members that said that everybody deserves health care in our state. And now we're having conversations about stripping that health care from my father, stripping that health care from your neighbor, and stripping that health care from Minnesotans. Would you ever, and to the public, would you ever take a vote to strip health care from someone that has cancer, someone that has diabetes, someone that needs emergency care, someone that is taken to the hospital to receive life-saving medication? I don't think that's what Minnesotans believe in. And I don't think Minnesotans believe in taking that vote. And I'm thankful that my father has been able to receive healthcare support, has been able to continue to get biopsies to make sure that his cancer is in a better place. But stripping that away is stripping healthcare away from your neighbors. And when the legislature first passed this, it was because we believe in an inclusive state, an inclusive healthcare system, not an exclusive one. Let's not create an exclusive healthcare system. Let's continue to make it inclusive. Thank you.
Good morning. Thank you, Councilmember Chavez, for sharing your story. My name is Samantha Sensamura, and I'm the state representative for District 63A in the Minnesota House, representing South Minneapolis. I'm proud to stand here today with the POCI Caucus as the first Japanese American legislator elected in Minnesota. My family's own legacy in this country of internment and imprisonment is part of what led me to want to run for office, and is why I feel so compelled to speak up now. During World War II, my grandparents, along with 120,000 other Japanese Americans, were interned and imprisoned by the U.S. government because of scapegoating and fear. This history is often forgotten or not told, which is why in 2023, I, along with my colleagues on this stage, passed the Ethnic Studies for All Act to ensure that students across our state can have access to an honest and accurate version of U.S. history. We know that if we do not learn our history, we are apt to repeat it, including some of the darkest moments in our country. Unfortunately, today we see our government using some of these same laws and the same rhetoric that interned and imprisoned my grandparents. And that's why I'm standing here along with the Japanese American community to say never again, and not on our watch. I'm proud to now introduce Japanese American community leader and Japanese American internment survivor, Sally Sudo, who will share more of her personal story of her family's internment and what we can learn from their experience at this political moment. Japanese Americans stand in solidarity with all immigrant groups, and Sally will share more about why.
Thank you, Samantha, for asking me to be here today. My name is Sally Sudo. Our family has lived in Minneapolis since 1945. We came here 3 days after the end of World War II. Previous to that, we had been living in Seattle, Washington until the Executive Order 9066 was signed by President Franklin Delano Roosevelt, which declared our area a military zone. And the military was put in charge, and they were able to decide who could live in their zone and who had to be removed. As a result of that, over 125,000 of us who are of Japanese ancestry were removed from our homes, lost everything, not only our homes, our businesses, our livelihoods, and had to spend the next 3.5 war years behind barbed wire fences, being watched by armed guards. And yet, 2/3 of us were American citizens because we were born here. So we never want something like that to happen to any other group of people in America again. That was really one of the worst injustices that was perpetrated on the United States citizens. And I'm here as a witness to declare that we are fighting any kind of injustice, and we want people to speak out whenever they see any injustice around them. Thank you.
Buenos dias. Good morning, Minnesota. My name is Representative Maria Isa Perez Vega. I represent the district of our capital here, St. Paul, 65B, as well as half of the suburb of West St. Paul. I am proud to be here to speak with my colleagues of the POCI Caucus as well as our community leaders as we face a time where folks want our communities to live in fear. As I am in my second term, I think about what we have heard in these stories, these collective stories that contribute to our work, but also to the implementation of celebrating our cultures and celebrating what our culture brings in a diverse way as a diverse community in our leadership to the state of Minnesota. And I want to highlight the impact that it is that our immigrant community brings so that we can get the story straight when we talk about how much money is being taken away and how much money is actually being given to the state of Minnesota by our immigrant community and how it impacts everyone's health care. Undocumented immigrants pay taxes in Minnesota. The most recent estimate is that the total's over to $222 million a year in state taxes. And data from DHS shows that enrollment in Minnesota care by undocumented immigrants has exceeded the expectations from 2023, but very importantly, the average cost per enrollee has been significantly less than earlier estimates. One very technical in-the-weeds reason for this is that undocumented immigrants' participation in Minnesota care is entirely on the fee-for-service model, which is administered by DHS. 2023 estimates made assumptions about costs using the managed care model, which provides a set payment to insurance companies for each enrollee each month. The reason to believe that managed care costs the state more per enrollee than public programs administered by DHS. Hospitals are bound by federal law and the Hippocratic oath to treat people in life-threatening situations regardless of their ability to pay. If an undocumented immigrant is in the emergency room, they will receive care without insurance. However, the hospital is unlikely to receive payment for those services, contributing to a major financial problem facing providers that we refer to as uncompensated care. Preventive care is important on both human and economic levels. Not only does preventive care improve health outcomes, it means fewer people end up in the ER for conditions that could have been prevented. Without insurance, people are less likely to seek preventive care, and the overall burden on hospitals and emergency rooms go up, which contributes to ER overload and hospital closures, which affects the health of everyone, as well as the burden of our workforce that we hear from our state nurses on an everyday basis. I want to highlight the fact that our immigrant community was left out of the Insulin Affordability Act when the governor signed it in 2020. And in our first term, and as somebody who lives with this chronic illness every day, our community of insulin-dependent diabetics were dedicated to ensure that our immigrant community that faces one of the highest disparities in this illness and the rest, when we talk about the impact of what HIV and AIDS brings to our communities of color, we can talk about heart conditions, we can talk about the disparities of health, of who it impacts, and who are the most people showing up to work every day that is impacted by this, should not have to go about when you listen to the stories of elected officials and those who are unelected to talk about the real things that are happening as nightmares. We're not going to live in fear when we see how our POCI caucus and our state legislatures has contributed to workforce by cultural community events that happened in my district this past weekend that showed we are not going to shut down our celebrations of what we do, what we give to this state. So I don't want to hear any more of how much and this and that, because the data's out there. And our community organizers have been leading just as much that we were able to include in our last session so that insulin accessibility could be offered to everyone, whether you are documented or not. The reality is that Minnesota has a lens on us. And it has a lens because we are working together, and we are going to continue to work together with our community leaders when it comes to the impact of what we're able to do and build with little resources. So at this point, I'd just like to say that we are protecting the laws that we've brought to make history. We are protecting our children and our families. We're contributing to the investments that are made when we talk about capital investments. And we're talking about education so that all of us Minnesotans can grow together in this world that is attacking our humanity. With that, I'd like to open up questions from those in the public.
I wonder if one of the lawmakers up there can talk about sort of what recourse you have. You're in a divided government now, different from the past 2 years when you were able to pass all these policies. What do? How do you communicate to other members of your party that you really need to keep these things in place?
Well, I think what we do is what we keep doing, right? We keep working, we keep fighting, we keep negotiating with people, we keep talking with folks, we keep making sure that the stories from our community is front and center, right? What we want to be able to do today is not just tell the story of, oh, this is expensive, this is costly, this somehow is a drain on our system, but actually how it makes our system better, how we're actually benefiting from what we passed, from the investments that we did over the past 2 years, and how that is now coming to fruition and will actually make Minnesota a much better state for people to live in. So that's the work that we're doing.
In regard to some of these, in, I guess a similar vein, in regard to some of these pieces that are being floated as things Republicans are looking at as priority cuts, Minnesota Care being one of the prime examples of that. I mean, they're being floated as negotiations pieces. I mean, the governor has, said he supports these programs unilaterally, but also that nothing's off the table when it comes to negotiations. I mean, does that sort of situation worry you guys?
I mean, I think whenever we hear that a lot of the pieces that we put in place last year, from Earn Sick and Safe Time, from the UI benefits, from ethnic studies, from, environmental protections, when any of those things is on the line, we get concerned, right? Because the first people who are affected by that are some of the most vulnerable in our community. So it's a lot of our Black and brown folks, it's a lot of our immigrant community. And so we want to make sure that we're living in a state that doesn't leave anyone behind and that ensures that whatever compromises we may have to make in the future is one that's equitable and one that makes sure that we've taken into consideration everyone who will be affected, and then that those cuts, if they have to be made, are dispersed equitably across the population.
It seems that the priority of the POCI caucus are pretty firm on maintaining these programs. What about the broader DFL caucus? Do you foresee, any DFL members moving on any of these issues?
I mean, I hope not, at least in the House. We seem to be working together in lockstep in the House. We've seen in the Senate there's a little bit more, but we have a senator here who can talk more to that about how they're connected there. But I do see all of us as working together to try to protect what we gained over the last 2 years.
Are there other bills where House Democrats might try to sideline it? I know there was the issue around hourly worker pay for unemployment insurance. Is that something that you would look to do if there are provisions like paring back Earn Sick and Safe Time or paid family leave?
I mean, I think at the end of the day, we'd have to look at what is presented, right? What is hopefully come to that conclusion together. I think that's really what we're asking for, is that we want to make sure that we're making that decision together and that we're making those decisions in a way that ensures that we are protecting as many Minnesotans as possible.
Being that it's a divided House, I mean, is there any sort of give with any of these programs that, could happen? Give a little bit to the Republicans to appease maybe a little bit of what they want, but maintain some of these programs in some sort of way?
Again, I mean, I think, there's a variety of ways to get to the end of a session year, right? But I think what is most important is making sure that we're not scapegoating communities, we're not targeting specific communities, and we're not leaving certain communities behind because we think they're expendable.
I can also say one thing.
Yeah.
I just want to note that, the GOP has backed us into a corner of false choices, right? Where we are being forced to think about cuts to our most vulnerable populations, thinking about pitting seniors versus students versus workers. That is a false choice, right? We as a state need to balance our budget, but we do not need to do that on the backs of workers, on students, on our immigrant population. We have the option as a state to raise revenue, and Republicans have taken that off the table. So they have the same playbook as what they're happening at the federal level, where they are trying to cut programs, life-saving programs like Medicaid, to give tax cuts to billionaires and millionaires. So that's not what we're about at this table. That's a place where the Republicans have backed us into. But I think it's really important that we don't give in to that false binary.
Yeah, go ahead.
I'm State Representative Kaliher, and I just want to say that as a chair of a committee, I want us to remember that in the 67-67 split, there are things that Republicans want too. And what we are saying is these are the things that are non-negotiable for us. So as we're sitting at the table, Republicans are asking for things like tax cuts for corporations who are already making millions, billions of dollars. That is what they're trying to trade us for the things that we're trying to protect Minnesotans. And so what we're saying is these are the things that are non-negotiable. We did a lot of really wonderful things this past biennium. That means there are a lot of things that Republicans want to repeal, but there's also a lot of things Republicans want. And in order for us to move anything forward, they have to understand where our priorities are, and this is our way of saying these are the things that we will not compromise on. So for the things that they want, they're going to have to think responsibly about how they're going to, as Representative Agbaje said, is distribute this evenly across. If you look at all the things that Republicans proposed in the first few weeks in which they illegitimately took control of our government, that the bills that they put forward were about giving tax breaks to the richest Minnesotans. It was about giving tax breaks to corporations. It was giving money away for individuals who want to build large types of data centers that would take up our water and our energy systems. And so those are the things that they're looking for. So I want us to remember who is on the side of people and who is on the side of the wealthy and corporations.
So just to clarify, if a global deal pares back any of these programs in any way, will you all be voting against any of those bills? Or?
I mean, we're not at that time yet, but there's still a lot of time left in the session, so there's still a lot of time for discussions and negotiations. But again, we have stated where our priorities lie, and as my colleagues have stated, there are many questions that I think folks should also be asking of Republicans about, when will they start to become more reasonable in order for us to have a conversation for real.
Do you guys get the sense that there's a genuine disdain for these policies in particular, or is there a sense that this is also sort of about the trifecta and kind of paring back some of the work done by the trifecta?
That's a great question. I think we can focus in on what exactly they're trying to cut, right? They're trying to cut paid family leave, which will disproportionately impact women and women of color. They're trying to cut UI for hourly workers, which will disproportionately impact women and women of color. They are trying to cut Minnesota Care, which will, of course, disproportionately impact immigrant communities, people of color. And so everything they're trying to cut impacts a very specific group of people. And in turn, again, they want all these cuts done so they can pay for other things. But if we cut Minnesota Care, right now the program has cost $3.4 million. They're not going to pay for anything with $3 million. That covers nothing. So the purpose of cutting Minnesota Care is not to pay for other things. It is to hurt immigrant communities, period. And that's what their goal is, and we are not going to allow that to happen.
Are you getting any sense of comfort from what you're hearing from caucus leaders as they're meeting with Republicans and with the governor? Are they giving you a sense that they hear you and they also want to maintain everything that you're talking about?
I wouldn't say it's a sense of comfort. I think Representative Abaje noted that, things are in negotiation, and we're not backing down from protecting the laws that are supporting and acknowledging the dignity of our immigrant communities and communities of color.
Yeah, and I would just note that, as I said, folks are still talking, and so, they are also listening to us, they're also hearing us, so we will see what comes from that, but what we want to do is make sure that the real stories of real impacted people are out there to make sure that that's part of the conversation as well. We can take no other questions? Okay, all right, thank you so much.
Thank you for being here.
Oh. Thank you.